Does a ketogenic diet help you live longer, or could it actually shorten your life? There is something almost compelling about keto when you first try it. Within days, sometimes within a single week, the scale starts moving. Clothes fit differently. Blood sugar readings flatten out. That persistent afternoon hunger disappears. For many people who have struggled with weight or blood sugar control for years, it genuinely feels like a solution. And in many ways, the short-term improvements are real. Triglycerides fall. Glucose becomes more stable. Visceral fat starts to decrease. These are markers we associate with better metabolic health and longer life. But here is where it gets complicated. In some people, not all, but a meaningful proportion, keto does something else. It sends LDL cholesterol climbing, sometimes dramatically, and now you have a situation where some of your health markers are improving while another one, which matters enormously for long-term cardiovascular risk, is moving in the wrong direction. You can feel great, look leaner, have better glucose control, all while potentially accelerating the silent process that leads to heart attacks decades later. This is the keto paradox, and it is worth understanding honestly. My name is Dr. Victor Hayes. Today I want to cut through the noise and give you a genuinely useful answer to whether keto supports longevity, who it is likely to help, who it might harm, and how to use it in a way that does not trade short-term gains for long-term risk. Before anything else, let me clarify definitions. When I say ketogenic diet, I mean a very low carbohydrate approach, typically 20 to 50 grams of carbohydrate per day, restrictive enough to push your body into ketosis, where measurable ketone bodies are being produced as an alternative fuel source. Low-carb diets broadly are a different category. You can reduce carbohydrates significantly without entering ketosis, and the outcomes can differ substantially. Many studies labeled as low-carb research are not actually testing ketogenic diets. The distinction matters when interpreting cholesterol data. Second clarification, longevity is not about the label you attach to your diet. What determines whether you live longer and avoid chronic disease is what happens to your measurable risk factors across decades. What are those risk factors? Body composition, particularly visceral fat, blood pressure, glycemic control, and insulin sensitivity. ApoB, your atherogenic particle count, which predicts cardiovascular risk more accurately than LDL cholesterol alone. Fitness, your cardiovascular capacity and muscular strength, both of which are independent longevity predictors. And diet quality and adherence, whether you are meeting fiber and micronutrient needs, and whether you can sustain this approach for years. These are the 6 categories that matter for longevity. Any diet has to be evaluated against all 6, not just how it makes you feel in the first 6 weeks. What does keto do well? The short-term benefits show up consistently in the research. Weight loss and appetite control are often substantial. Ketones themselves appear to have appetite-suppressing effects. Protein intake typically increases, which promotes satiety. Blood sugar swings are minimized. People who have struggled for years with persistent hunger often find keto remarkably manageable. Triglycerides fall on keto, often meaningfully. High triglycerides reflect metabolic dysfunction and cardiovascular risk. Seeing them fall is a genuine positive signal. Glycemic markers improve, particularly in people with insulin resistance or type 2 diabetes. When you remove most dietary carbohydrates, blood sugar naturally stabilizes. For someone with years of poor glucose control, this shift can be genuinely important. Blood pressure often improves as well, though this appears to be primarily a consequence of weight loss rather than ketosis itself. These changes taken together explain why keto feels transformative to some people. Multiple risk factors improving simultaneously within weeks. The question is whether those improvements translate into longer life. And this is where it becomes genuinely complicated. While keto improves glucose, triglycerides, and body composition, it can, in a meaningful subset of people, dramatically increase LDL cholesterol and ApoB. And this is not a minor footnote. This is the single most important long-term cardiovascular risk factor. Atherosclerosis, the gradual buildup of plaque inside arterial walls, is the process that leads to most heart attacks and strokes. The driving force behind plaque formation is the retention of ApoB-containing lipoproteins in arterial walls. Higher ApoB means more atherogenic particles circulating, which means greater cumulative plaque risk over years. LDL cholesterol is a reasonable proxy when ApoB is not measured. Ketogenic diets, particularly those heavy in saturated fat from sources like butter, cream, and fatty red meat, can raise LDL substantially in some individuals. These are sometimes called hyperresponders. Their LDL might climb from an acceptable level to a high-risk level within months of starting keto. Not everyone responds this way. Some people's LDL barely moves or even improves, but you cannot know which group you belong to without measuring it. If keto improves your glucose and triglycerides but significantly elevates your ApoB, you have not found a longevity diet. You have found a trade-off. You are potentially improving one set of risk factors while worsening the one that matters most for cardiovascular outcomes over the long term. The mortality data for keto specifically is limited and messy. Observational studies struggle to distinguish true ketogenic diets from moderate carb restriction, rely on unreliable dietary recall methods, and involve significant confounding. We do not have long-term randomized controlled trials assessing keto and mortality. What we do have is strong evidence for how specific biomarkers affect long-term outcomes. And if ApoB or LDL climbs sharply on keto and stays elevated for years, that represents meaningfully increased cardiovascular risk regardless of what your diet is called. In the absence of definitive mortality data, the rational approach is to focus on the biomarkers we know predict outcomes and monitor them carefully. Who is most likely to benefit from keto? People with significant insulin resistance, type 2 diabetes, high triglycerides, fatty liver, tend to show the most meaningful improvements. If your glucose regulation is genuinely impaired and your body is struggling with carbohydrates, removing most carbohydrates can produce rapid, clinically significant metabolic changes. For this group, keto can be a powerful intervention, particularly with medical supervision. People who respond well to clear dietary rules also tend to do well on keto. The simplicity of eliminating carbohydrates can be easier to follow than vague moderation guidance that requires constant decision-making. Who should be cautious? Anyone with known cardiovascular disease or already elevated LDL or ApoB needs to be very careful. Keto could make things worse. People with a history of eating disorders should generally avoid highly restrictive dietary approaches. Pregnant or breastfeeding women, children, and adolescents have specific nutritional requirements that make very low carbohydrate eating inappropriate without specialist guidance. People on diabetes medications, particularly insulin or sulfonylureas, face genuine hypoglycemia risk if carbohydrate intake drops sharply without medication adjustment. This requires medical supervision. If keto makes sense for your situation, here is how to do it in a way that maximizes potential benefits while minimizing cardiovascular risk. Measure the right things before you start and again at 8 to 12 weeks. Check ApoB or at minimum LDL, non-HDL cholesterol, triglycerides, HbA1c, and blood pressure. If LDL or ApoB climbs significantly, you must either modify your approach or reconsider whether keto is right for you. Assuming your cholesterol is fine because you feel good is a mistake that can have serious long-term consequences. Build your fat intake around unsaturated sources. Olive oil, genuine extra virgin olive oil, oily fish, nuts, and seeds rather than butter, bacon, and fatty cuts of red meat as your primary fat sources. Saturated fat is what tends to drive LDL elevation in susceptible individuals. You can achieve and maintain ketosis while eating predominantly unsaturated fats, and your cardiovascular risk profile will be substantially better as a result. This version of keto looks very different from the common stereotypes and aligns much more closely with what we know about vascular health. Do not confuse being in ketosis with being healthy. Ketosis is a metabolic state. It guarantees nothing about nutrient density, gut health, sleep quality, physical fitness, or longevity. You still need whole, nutrient-rich foods, regular exercise, stress management, and adequate sleep. Keto does not provide a free pass on any of those fundamentals. Consider cycling. For many people, keto works best as a phase rather than a lifelong commitment. 3 to 6 months to lose visceral fat, improve insulin sensitivity, and reset metabolic health, followed by a transition to a less restrictive, more sustainable long-term eating pattern that maintains your improved biomarkers. There is no requirement to remain ketogenic indefinitely. The best long-term dietary approach is one you can sustain for years while keeping your risk markers in a favorable range. Here is the honest bottom line. If keto improves your weight, glucose, and triglycerides while your ApoB and LDL remain favorable, it can be a useful tool, particularly if you are starting from a place of significant metabolic dysfunction. If it spikes your cardiovascular risk markers, it is not a longevity strategy. Longevity is not dramatic. It is not about finding the optimal diet protocol. It is about finding a way of eating you can sustain for a decade that keeps your biomarkers healthy, that you actually enjoy, and that allows you to live your life. Keto is a lever. The only question that matters is what it does to your risk profile. If you pull that lever, measure the results, adjust based on the biology, and do not let ideology override the evidence. If this was useful, please subscribe to this channel and share it with someone navigating these questions. I will see you in the next video.